So any surgical or laser procedure is as safe as the competence of the surgeon. Generally, complications arise because the surgeon is not familiar with the procedure or he has gone out of the compliance to recommended surgical guidelines. And complications arise only when the surgeon steps out of the limit of his competence. If he is not well trained or he doesn't know the possible complications, then chances are he will cause the complication. And experience is very important, and that's the reason why apprenticeship and courses and workshop webinar like what Patrick is organizing is very useful, especially for the younger doctors who are venturing out to carry out some of these procedures. And in the Asian country, we have more complications. They are peculiar in people with skin of color, and we have to watch out for them. The cardinal rules, basically, these are what I've listed out. There are about 13 rules that you must follow if you want to prevent complications from aesthetic dermatological procedure.
Okay.
Understand?
Okay. And first, I'm honored to speak in this meeting. Thank you, Dr. Patrick Huang, invitation. And thank you, Dr. Lee, introduced me. And I'm happy to see the Dr. Gao Lin, my old friend, and Yuan in California, my new friend. And I see the doctor and I listen to Dr. Gao. It's a very excellent lecture. Sorry, I cannot join the conversation before the meeting because my trumpet and the microphone is disconnected. But fortunately, it's now fixed. And my topic is laser hair removal, complication and prevention. I'm a dermatologist and I have my private practice in New Taipei City. And according to JAMA 2014, the most common regulated laser procedure among malpractice cases is laser hair removal. And the dermatology surgery in the same year is the hair removal is the most complication and followed by the photo rejuvenation. And after several years, this year, dermatology surgery published a paper, cause of the injury in the lactation in cutaneous laser surgery. And the most litigated procedure is still the laser hair removal. So at the last, before we treat the laser hair removal, we have to ask if am I treating the correct indication and patient with correct laser? Was the fluid appropriate? Was the plus duration appropriate? Was the correct spot site used? Was the quality appropriate? Was there too much overlap or sack or plus? Now I suggest we can use a checklist to minimize the complication from the laser procedure. We can, including the skin condition, the patient medication, attach the round hair piece, confirm the accurate safety, confirm everyone has eye protection, maybe hat and evacuation, and the procedural care. So preventive approach must be comprehensive and carried out at every stage of treatment, including the user, device, and the patient. Thank you very much. Listen to my speech.
We may think it is safe, but this actually may cause eye injuries to patients' eyes due to the light reflection and scattering. Why do we avoid having an aluminum alloy card or a very reflective mirror in the laser radiation place? We will tear through the following examination. In this video, we will know about reflection of CO2 laser. Ceramic tiles, small mirrors, and stainless steel are used for the experiments. When the laser hits on the, let me show here, yeah. When the laser hits on the ceramic tile, it quickly reflects to the opposite side. With glazed tiles, the effect of reflection is similar as the thermal paper.
Yes, I will use the short-term topical steroid because some patients will have the burning sensation after the hair removal. And there's a problem. There's a paper say more neutral field after the fractional CO2 laser. So some professor in Taiwan suggest use the oral steroid for make the less the neutral field and the less inflammation, and he portray liver will cause less pH. So, so actually,
Yeah, but has there been any study? You know, is there any publication, any study, any?
It's just a basic paper, and like a biopsy show the more neutral field, many neutral field after the CO2 laser. So the mechanism is use the oral steroid is to reduce decrease the neutral field count. Hey, but not a clinical paper. Hey. And I do use the topical steroid for several days after the laser hair removal. But if the